would describe my experience working with home health and hospice of Kansas as a rewarding one. You get into a lot of situations that are, chronic diseases and end of life matters, where you deal a lot with family members, primary caregivers, friends, and so forth, where you literally watch kind of the process through. And I think that provides me a higher degree of compassion, and I bring that to my practice. Keeping folks comfortable, keeping families intact, keeping patients at home is largely rewarding, and at the end of life, it's always a challenge, but it's probably one of the more rewarding things I do. The one thing that really interested me about Home Health and Hospice of Kansas was the work they do with the veterans. I happen to be a veteran myself, and that was very appealing to me. So we, in addition to veterans, we see a lot of different patients from a lot of different walks of life. But it was really that veteran that kind of hit me and made me want to join them. Having that conversation with a patient and or their family about whether or not to choose going on to hospice is probably one of the more challenging conversations you'll have. But one of the things that I try to bring to the table when talking about hospice is informing them about what hospice brings to bear. I think once we get to start working together and understanding what the objectives are, it's not about me, it's not about them, it's about the patient. And when we work together, it's a collaborative effort. At the end of the day, we can all look at each other in the eye with a great deal of respect, knowing that we did what's best for the patient. But oftentimes having those conversations after somebody has passed away, usually there's nothing but gratitude and a lot of thanks for what the company was able to bring. They've got a really good team of nurses who I think are probably some of the best in the city. They are not only good at what they do, they're very passionate about what they do. They care. We are in constant touch on a encrypted text that we use. So the communication when it's my turn or it's my week is literally nonstop, 24/7. So we are constantly in a position to be making things better for the patient and for the family. And so for me, it's really been the staff and the people I work with over there. They're absolutely terrific. I have been with them long enough that I would use them for myself or for my family. I mean, I again, it would go back to the folks that are on the team, watching them in action, watching how they care for the patients. I think their care is second to none.